Let's welcome back infectious disease specialist Dr. Zain Chagla to answer questions all things COVID. Good morning. How are you?
Hi, Bob. How are you?
Good, good. Let's start with the new modeling that we received in Ontario this week. What did you see in the graphs that you liked, and what's worrying you?
Yeah, some fascinating stuff. I think overall the trend of Ontario seems to be growing, but not growing as fast, which is good. Promising that also our ICU beds may not likely be filled up at the end of this, which is good, considering that we want to also balance health systems along with COVID-19. Interestingly, it seems like it's a tale of many different outbreaks. Toronto seems to be a place where they're having difficulty tracing a lot of people. Whereas a number of other settings, it's actually not that. It's outbreaks of clusters that are traced easily by public health, and I think that's the scenario we're seeing in Hamilton. The one big downside to all of this is the growth in long-term care seems to be increasing, and the deaths in long-term care seem to be increasing. And really, that's a very vulnerable population that's going to be hit hard as we get through this second wave.
Mm-hmm. But we really need to continue a targeted approach here, because it is different depending on where you are. If there's one thing that you could say or do to ensure, just to make sure people understand the seriousness here, what would it be?
Yeah, long-term care deaths are going up. Long-term care deaths are occurring in places that haven't seen a lot of COVID. There's 2 outbreaks now in Brockville, Ontario, that haven't had many COVID cases, period. And so, it's worrisome in that sense that you're actually starting to infiltrate long-term care homes despite having low community rates in the city.
Now we're heading into flu season, and we're getting good participation as far as people getting flu shots, I believe. You can confirm that. But there's a new study that indicates the standard flu shot might provide some protection around COVID-19. Thoughts on that?
Yeah, so they looked back at folks who had gotten their flu shot in the wintertime last year before COVID-19 hit, and just saw that generally, as compared to the population, they got COVID-19 less than the average population. And the author said, well, maybe there's some immunity or boosting of the immune system that happens when you get the flu shot. In reality, these studies need to be borne out. It's an interesting signal. It could very well be that people who get their flu shot tend to also wash their hands, distance, wear a mask more adequately than others because they have good health-seeking behaviors. But, it's for the people that seem to think that the influenza vaccine will do something negative to COVID-19 or worsen the chances of getting a COVID-19 shot, there's probably some data here to suggest actually there might be the opposite. There might actually be a benefit to getting the flu shot coming into the season.
Oh yeah, we've heard the conspiracy theories saying otherwise. I think it was called virulent interference.
Yeah, exactly. Again, people will make things up about the immunology of this, but at least there's some counter data suggesting it's actually protective.
Yeah. Hey, let's talk about vaccines. There's a doctor across the border we've all heard of, Dr. Anthony Fauci, who says there's going to be a vaccine by December. Is he referring to the Oxford vaccine? And in your opinion, which one's the front runner?
Yeah, both of them are coming out. I think their first phase 3 data will be by the end of the year. Moderna, the mRNA vaccine, says November, end of November. And again, the Oxford vaccine seems to be December. I think the interesting part is how to actually balance which one to invest in at that point, right? If we have 2 that have success, then it's how to tease them apart. But, hope is certainly coming for a vaccine. And again, probably by the new calendar year, we'll start talking about distribution networks and actually getting it out to the population.
Okay, where are we at? How well are we doing as far as treatment drugs? Because, there's been the problems we've talked about with remdesivir, and Eli Lilly had a setback.
Yeah, the remdesivir is starting to come off the table. It seems like there's a small amount in Canada, and we're using it to help with hospitalizations, but it's probably not a miracle drug here. Eli Lilly had a problem with the monoclonal antibodies, although another trial that came out this week suggested it might prevent people from coming to hospital, which is maybe something to investigate a bit more in patients in long-term care. But there hasn't been anything other than steroids that have really shown that significant effect to preventing death. But you know what? Based on 6 months ago, I'd rather be here today knowing what we should be giving rather than giving random drugs and seeing what happens.
Right. Well, we've run out of time as usual, but we'll chat again next week, and have a great weekend in the meantime. Good to see you again, Dr. Zain Chagla, infectious disease specialist.
No worries. Happy Halloween.